is your Houuston chiropractor, Dr. Gregory Johnson, and today I want to introduce you to Ruby, who is 83 years old, 86 years old now, from my understanding, and we're going to cover something we've never covered before, which is a kyphosis from degenerative joint disease or degenerative disc disease and compression fractures in her mid-thoracic spine. And I'll show that to you in a second. But first thing we're going to do is we're going to analyze her on the XYZ axis like we do everyone. Let me help you up here. Okay. There we go. Now, as you can see, it's difficult for her to get around, so she uses this walker for the most part. I've got you, and I'm not going to let you fall. Just face towards the mirror for me. There you go. Okay, now just relax your hands down here, and I've got you. I won't let you fall over. Okay, now I want you to close your eyes and flex your head forward, and now backward. Now come all the way back, and now normal, normal, there. Okay. Now, as you can see, she has developed the ultimate forward head posture, FHP, forward head posture, and because of this, you can see right here in the center of her spine a very large V-shaped hump. This is a posture that develops over time because gravity is constantly pulling us towards the earth, pulling us down, and if you're misaligned in gravity over a period of time, gravity is going to win that battle. So you start off when you're younger in a good posture, and you start off then with the forward head posture, working on computers, and then you go around for the rest of your life like Ruby has without ever correcting that, and then you develop this condition known as kyphosis in degenerative joint disease. So let's come over here now. Let me walk you over here. Now we've got to be very careful working on Ruby because she's 87, 86. I'm going to get it right one of these times.
86 and a half.
86 and a half. There you go. Now, let me have your glasses, hon. There you go. And I'm going to have you lie on your stomach here for me. There we go.
This way or this way?
Head up here, hon. Face right down in here. If I can help you get your leg up there. Okay. And as you can see, pretty much any activity is a chore for a person who has these conditions. And that's not just her, that's everyone. Here, let me help you down. I got you. You just make it nice and easy here. There we go. Yeah. See where we get our workout every day? Okay, now we're going to have her just rest her arms here on this here. Now, do you mind if I lift your shirt up? Show people? Okay, now, you can see, Renee, come closer here, and I want them to actually see the level of kyphosis in her thoracolumbar spine region, which is one of the most stressed areas of the spine. It's right where the thoracic spine changes into the lumbar spine. And as you can see, her vertebrae are all protruding backwards in a sharp V shape. And then going down into the lower back and pelvis, she's got a little bit of that curve there, but not much. So, how do we treat these kinds of patients with this kind of condition? Very gently. But we are going to adjust her. By the way, there is no actual cure. Did you feel that move there? Yeah, that was very good. That was her right sacroiliac. There's her sacrum. We're not going to cure her of degenerative disc disease or degenerative joint disease or osteoarthritis. Those are all synonymous terms. But what we can do for patients like Ruby is to improve the quality of their lives. Now you're going to notice that I'm just barely putting any pressure in here because her bones are brittle in all probability, she's got osteoporosis in there. And here, coincidentally, by the way, she's in here today because of her daughter watching us on YouTube regarding hiatal hernia. And she has hiatal hernia. We've been talking about that quite frequently. Look at the part of her spine that is the most subluxated, that is right down at the base of the ribs attachment. See, those are all tender, aren't they?
Oh, yeah.
Okay. I'm not going to press on Ruby as hard as I do some people because she's a lot nicer. So I'm going to give her a little break. Okay, now, I'm going to scoot you way up in here, Ruby, if you'll scoot all the way in there and let your head hang forward. Here, let me help you up. There you go. Okay. So we're going to do some soft tissue work on her with a deep vibratory type of myofascial release, and this helps stimulate blood flow into the muscles and ligaments and tissues in the spine, and it also helps carry out metabolic waste products of normal cellular metabolism. So now we actually got some pretty good adjustment movement down in the right sacroiliac joint today, but she suffers a great deal from not only the spinal pain but the organ function related issues such as her gastrointestinal system, the hiatal hernia / acid reflux, where she's getting a lot of pain and nausea with that. And we also, of course, would be wanting her to go to her own physician and make sure that she gets a physical, thorough blood testing analysis to evaluate for a number of different types of pathology. I'm not the chiropractor that says we can cure everything. I think that when we work together with the medical doctors for the patient's best interest, the patient wins, and that's how we like to practice here at Advanced Chiropractic Relief. It's not about us, it's about the patients winning, feeling better, and if we can improve the quality of their life just a little bit by what we do, we're very happy with that. I wish I could cure her. I would if I could, but there are limitations to what I can do. But her legs are even now, and she's not having any problems on that. She got a little bit of positive knockles, but not much. That didn't hurt much, did it? To raise her legs up. Now, she's going to find these muscles here are still pretty sore, and I'm putting some very deep, direct pressure in the paraspinal muscles, not on the vertebrae themselves, but on the paraspinal muscles that run parallel to the spine, which in this area here is the base of the trap, stops right in here, and then you start having the lumbopelvic musculature as well as the erector spinae musculature involved, 4 layers deep, and those are sore spots, aren't they? And again, we want to just encourage our patients to breathe while we're doing this, because when you hold your breath, it actually makes it worse. So, and we've also ordered some digital x-rays on her spine to see the level of degeneration and compression fracture in here that's causing this severe kyphosis in her lower thoracic spine. Now I'm also doing a little transverse friction here at the same time on each side of the paraspinal muscles. Now she's got huge knots in her paraspinal muscles on both sides, showing that this is a very chronic condition. Chronic meaning longer duration than 3 months or more. And she has had this more than 3 months for sure. Okay. But she's been to how many other doctors here in the past year, did you say?
Well, she's had at least 2, but she's had several surgeries and all.
How many surgeries has she had so far?
Well, on her back, 3.
She's had 3 surgeries on her spine so far.
Yeah,
And hopefully they'll be the last. Again, what we're doing here is trying to improve the quality of her life and decrease her pain. And hopefully that will keep her from having to go back in and have another surgery. And we'll see all that as well whenever we get the digital x-rays back. There we go. Good job. Now, because of her age and also the likelihood that she has some atherosclerosis or plaquing in the arteries, I'm not doing any manipulative moves on her cervical spine. And I don't want any blood clots forming or embolisms going to the lungs or the brain. And you're familiar with this adjusting instrument. It's a high velocity, low amplitude adjusting instrument. And I do use this to adjust. Well, that's too strong. You also need to control how deep this one goes too. And we got it on very light right there. Right there. Now I'm actually going to adjust right here at the apex of her kyphosis. Okay, you're doing good, Ruby. Okay. Now, I'm just giving her a little diagonal, lateral, oblique traction. Like I said, we're not getting too deep, too rough, because she's just not ready for that. Okay, let's have you sit up here now. Whatever way's best for you. And tell me how I can help. Okay, you want to bring your legs over to this side? Okay. Here, I'll help you put that arm. Here we go. I got you. Okay. You want to lift that arm up? Yeah, there you go. Good. There we go. I'm going to lay you on your side. There we go. That girl. Now, let's bring both of your legs here, over. And now, let me help you up. See, then we can help the patients get up sideways. There we go. And that was easier getting up that way, wasn't it? Yes. Okay. Here we go. Come help. Here, let me help you up. Just grab onto me. There we go. Very good. Now, let's come back over here. There we go. First of all, tell our viewers how that felt. How did it feel to you?
Talk to Renee.
Yeah. Tell Renee how it felt to you.
It felt good.
Yeah. Do you feel like you're standing up a little straighter right now?
Yes, I do.
Yeah. Yeah. So see, even though you can't cure someone of these serious type problems, you can improve upon them and improve the quality of your life. Are you happy with the improvement in the quality of your life so far?
Yes.
Yeah, we got a ways to go yet, but she's a good patient, so she's going to make those. Okay, let's come over this way and look in the mirror again. Now, just from the treatment that we did on her today, she's actually getting around a little quicker today.
That's what I was thinking, yes.
Yeah. Okay, let's stand right here again. No, wait. Here we go. I got you. Now, close your eyes again. Bend your head forward and then backwards again. Back all the way. Now, back all the way. Head back all the way. There you go. Now, normal. Very good. Now, I got you. Now, if you look, she actually has her head a little bit more up and back than she did before. And I'm not done with her adjusting yet. Here's what I need you to do, Ruby. Hold those up like this. And let me have your head come all the way back here for a second. Now we're adjusting her in a mirror image of her biomechanics. I got you. There we go. There. Okay. There we go. I got you. I'm not going to let you fall. I haven't lost patience on the floor yet. I'm starting to start with her. Okay, now relax again. There you go. Now, take a look. Speaks for yourself. She's having a little hard time staying up. She's a little weavy, but how's that feel to you right now? You feel a little straighter?
Yes.
Yeah, she's standing up taller. She's a little taller right now. Okay, I'm going to quit asking questions and let her sit down here. There we go. There we go. Good. So, Ruby, in your opinion, is this something you feel like is helping you? And we just got started too, by the way. This is only her second treatment. So I don't expect her to say things are hunky-dory at this point in time, but she is a very cooperative and easy patient to work with, so we'll see some results. And Ruby, you have anything last thing to say to everybody out here watching?
I think it's going to help me. And I think I'm in very good hands. He's very, very fine.
Thank you very much.
Very fine.
Thank you. It's always nice getting a compliment from someone as nice as Ruby has been. And this is your Houuston chiropractor, and we'll see you next time.